I'm Dr. Michael Atola.
And I'm Megan Strong.
And our case of the week will not only feature a case, but some dental litigation.
And then in the news, we go through the Tooth Fairy's phone and find Susie Orman on speed dial.
And in our viewer mail, we have a team write into us, and they have a Burke hit of their own for achieving great Crown and Bridge results. That and more on today's Chairside Live. Hey now, hello and welcome to episode 148 of Chairside Live. We've got an interesting episode for you today. Megan, how you doing?
I'm doing great. How are you doing?
I'm doing great.
I think there's a surprise back here. Do you know anything about it?
There is. I do. Dr. Erin Elliott was here
it's heavy.
last week on her birthday. Chose to spend her birthday, well, at least an hour, but at Gladwell Laboratories, taking a tour. Wanted to see all the different departments, meet some of the technicians, and
Nice.
we had thrown down a challenge that we were getting food from different dentists in different states, mainly because you were begging for food. And so we threw down the challenge to her, and this is what came from Idaho. It feels like a sack of potatoes.
It does.
It's got
it's
some
very
real
heavy, but you haven't looked in here, have you?
I have not looked
Neither
in
have I. Should we open it right now?
Yes, we should.
Okay. I'll do the honors.
I'm expecting dusty potatoes.
Wild huckleberry barbecue sauce.
Wow, nice.
What's that?
Idaho huckleberry taffy.
What? Very good, it says.
Huckleberry honey.
Huckleberry.
Huckleberry licorice. I had not heard of huckleberry till 10 seconds ago, and I've just pulled 8 products out of here.
What?
Huckleberry syrup.
Oh, that's going to be so good.
Huckleberry truffles.
What's that?
And huckleberry hand lotion. No, jam. You're correct.
Hand lotion.
Wow, look at all the huckleberry.
What is a huckleberry?
I don't know.
Maybe it's a
GTS? We'll have to find out. We'll have to
Google
look it up.
Stuff. Yeah, we'll have to check it out. But thank you so much. That is amazing.
Thank you, Erin, and her husband was here as well. They both took a walk around the lab, and I had no idea I thought it would be potatoes. I'm shocked that it is huckleberry. So thank you so much, Erin. Appreciate that. And again, a happy birthday to you, and thanks for spending some time here with us.
And happy birthday to me.
And happy birthday to you. When is it?
It was already July 28th, but this feels like a birthday present.
Oh, that's right. Well, consider that your present for me. All right, so on today's case of the week, I want to share 2 things with you. One of them is a malpractice newsletter that I subscribe to, and they always have dental cases in there, and there's one I want to share with you, and I want to take a look at an impression that's kind of an ongoing theme in my life recently, and that is the use of double arch trays for a bridge, which is definitely contraindicated. Let's take a look at that now. In this week's case of the week, I wanted to share 2 things with you. One of them is this case, but the first thing is something from a newsletter I subscribe to. This is Medical Malpractice, Verdicts, Settlements, and Experts. This is put together by a guy by the name of Louis Laska, and if you want to subscribe to this or do searches on the website, it's at verdictslaska, LASKA.com, and so it goes through every field of medicine and dentistry as well. And it's always fascinating to read about these lawsuits, to see just how different the 2 sides of the stories are, and to see what they're finding for the plaintiff and when they're finding for the defendant. So this one was actually a $4.5 million verdict with a root canal where a hole was made in the lower portion of the tooth and the filling material seeped into the mandibular space. Mandibular nerve was damaged. Patient now has to work from home due to dependence on pain medication and fatigue. And experts said that plaintiff would have to live with this injury unless she opted to have the nerve completely severed. The defense claimed the procedure went well and that the effects of the mandibular nerve were unrelated. So that totally just, diametrically opposed opinions here, and the patient was awarded $4.5 million because of that root canal where it sounds like there was a perf in the pulpal floor, and the filling material went down to the mandibular nerve. Damage to a lingual nerve during extraction, permanent numbness, loss of taste, $633,000 in Florida. Extraction of tooth blamed for speech impairment, and they actually found for the dentist in that case. Failure to identify fracture leads to breakage of the mandible during tooth extraction, found for the dentist in that one as well. And really the one that I wanted to show you is a topic that's come up before on the show, and it says strong anesthesia. That's not Megan. And it's really not even strong anesthesia. I thought this was going to be a verdict on buffered anesthetics, which I have found to be profound and rapid anesthesia when I've used them on patients. And I thought that's what they meant by strong. But really, they just mean Septicaine, Articaine, a 4% local anesthetic. And this is always kind of a question that comes up in my lectures, is whether or not to use Septicaine for lower blocks or not. So this is a plaintiff, patient age 49, underwent molar surgery, doesn't specify what it was, which included an injection of Septicaine. So they're implying that it was a block. Paresthesia of the lower lip and the chin subsequently developed. Plaintiff's expert opined the paresthesia was caused by the Septicaine. The defense expert opined that the effects of the Septicaine were a rare side effect. And according to published accounts, jury found in favor of the defense. So for the dentist in that case. And so I thought that was interesting that when brought in front of a jury, they actually found for the dentist there, which it seems surprising to me considering that there was paresthesia, because I've mentioned a dentist that I know on the East Coast where she had a block with Articaine and now has what appears to be permanent paresthesia. It's been over a year. And this is why I don't use it for blocks, even though the incidence seems low. But I just wanted to share that because this topic has come up a lot at lectures and even on this show about using Septicaine for blocks. And I found it interesting that the jury, I think sometimes as a dentist, if we have a patient who's got an issue like this, it would seem like 12 of their peers would be very quick to point the finger at the dentist, but this was a case where that did not, in fact, happen. So I wanted to share that because I thought that was an interesting, obviously we're missing a lot of the details in the story, but I thought it was an interesting result from a jury. So here's the case I wanted to share with you, and on the count of three, let's all shout together why this angers us at the lab. And of course, it's because it's a 3-unit bridge that was done in a double arch tray. This is a recurring theme, and it's probably because Cindy wants to prove to me that this continually happens, and so she keeps bringing me these cases. And what struck me about this one, though, I don't know how fresh that extraction was, but it was obviously somewhat recent. I don't know if it was that day. It doesn't seem like it was, but they're actually pretty good preps. The dentist has actually pretty good control. I like the margin placement. There's good retraction. We can see space almost all the way around there. That makes the dies very easy to trim. Anywhere where we have contact between the stone of the prep and the stone of the gingiva, it gets a little tricky, but you can see that line there. That's going to be easy to be trimmed. On the molar, we're looking pretty clear. Anywhere we see that dark space is good. We're going to have to guess just a little bit on the mesial of that molar. And the same is true for digital impressions as well. I know Josh looked at a digital impression and a conventional impression when he was here. And it's the same thing, the retraction. We still want to see this space, whether it's on a digital impression or a conventional one. Definitely some guessing there on our technician's part on the back. And that's why a consistent margin is really helpful. If the margin is the same thickness all the way around, then it makes it easier for the techs to guess. They shouldn't have to guess. We all know that's true. But the reality is there are going to be times where they have to go in and kind of create a margin. The distal of that, though, is definitely a guess. I would call that an educated guess on the mesial and more of a cross your fingers type guess on the posterior. So it's a good impression in places, but it's the wrong tray that was chosen. And the other thing that jumped out about this is when it's actually mounted and articulated. The reason why this doctor's getting a phone call is for not enough room. And again, you've heard me like a broken record talk about the use of depth cuts here. And the dentist actually prescribed a Bruxer solid zirconia bridge. We've talked about the rule of 27 before, and we do have 3 millimeters here between this gingival margin and the opposing tooth. So we have enough room for the connector here and here. We can go 6/10 here. But with the connector, with the bicuspid and the connector that we need here, we're going to have to spot the opposing. So again, it's 6/10, but it's a rule of 27 violation. And when you look at this tooth, it's hard to believe that there's actually enough room there. But when it was scanned, it was clear that there is, in fact, the required 6/10 of a millimeter, even though it doesn't look like it. So even in a case where a dentist reduces enough, for example, if this were a single unit crown, you can see we have 6/10 of a millimeter between this prep and the opposing tooth. So the doctor would not need to be called, but because it's a bridge and we have to have our 3 millimeters of connector vertically and 3 millimeters horizontally, remember it's 3 squared, which is 9, times 3, which is 27 for the rule of 27, we're going to have to either adjust this opposing tooth or do a little adjustment on the prep and do a reduction coping. So it's up to the doctor. We'll call the doctor and see which way he would like to proceed. But again, you can see it makes it difficult for them to do lateral excursions and protrusive when we just have a couple of teeth besides the prep teeth in that impression. At least we have the cuspid, so it's not the worst case scenario. But if we had a full arch impression, then we would have all the unprepped teeth over on the other side and really be able to use that to help dial in the occlusion. Because as it turns out, anytime you have to adjust the occlusal of any restoration, whether it's a crown or a bridge, our R&D department has been showing me some images of what happens when you adjust any material, whether it's a standard PFM, whether it's Emax, whether it's Bruxer, and the subsurface fractures that it creates and the stress that it builds up inside of the material. You don't even see it on the surface where you polish it. And then those fractures later on during function can connect and lead to a catastrophic failure. So the more they show me about this as we do more research on adjusting restorations, I've really kind of changed my mind and had to philosophically have a little shift about coming in and doing a little bit of reduction on the opposing. You hate to do it, but removing a little enamel here rather than removing some material from the finished bridge is going to lead to a longer lasting restoration, and that's probably something that the patient would vote for as well.
Thank you for that, Dr. D.
You are welcome.
Now let's go to a segment we call Viewer Mail. This week's viewer mail marks our first letter from two dentists. This is not two separate letters. This is one letter from two dentists.
It's a team effort.
It's a team effort. These doctors write in from Lake Forest, Illinois, and they write, Dear Mike, impressions first start with a decent prep, and the case in question, which he's talking about a case from Chairside Live a few weeks ago, the case in question shows this dentist hasn't been properly trained and is very likely not using the correct burrs or handpieces. First of all, relying on high-speed air turbines is like trying to whittle with a machete. Prior to electric handpieces we used, and still do, Cavo air-driven mechanical handpieces since 1992, 40,000 RPM. Below is a picture of our diamond burr block that is mostly made up of Vic Polar diamonds. Give this dentist an electric handpiece, ideal diamond selection, and a little training, and then you can talk about two-chord impression techniques and other things we use on a daily basis to record perfect impressions 100% of the time. If you are interested in doing a video that might really help dentists, please give us a call. And regards, that's from Dr. Richard Cottrell and Sharon. I'm not even going to attempt it.
Really? Okay.
Forscht.
Oh, there you go. Good enough. Yeah, that's good.
Yeah.
Yeah, Detola, everyone gets it wrong. They say Detoya. They think I'm Spanish. Well, Richard and Sharon, thank you guys. That's and they actually did enclose a couple pictures of their burr kit, which I like. It's named mine. The one that I have is the reverse preparation kit. Theirs is the Sweet 16 diamond block, and I'm guessing it's because there's 16 diamonds that are actually on there, and that's great. I see a round diamond. I see a lot of my favorite shapes on that. And you're right. You actually, I think, said this stronger than I do. I tend to temper the message a little bit because like you call electric handpieces the correct handpiece, and I happen to agree. In fact, I do have a Cavo air turbine, but really the only time I use it is on some second molars where a patient can't open very wide, and I just want the smallest head possible to be able to get there. We see a lot of second molar preps, especially in the lower where the distal wall is tapered at 45 degrees because the head of the handpiece won't fit. So really that's the only time that I use the air turbine. But I know doctors who are more like 50-50. Gordon Christensen, for example, still uses his air rotor about half the time and the electric the other half of the time. But much like you, I'm a huge fan of electric handpieces. I love being able to turn the speed all the way down to 1,000 or 2,000 RPMs and turn the water off. And the torque that's available with an electric handpiece has really become even more important recently than it was. You said you started, I think, back in 1992, I believe, and that's about the same year that I got involved with electric handpieces. But today we're having to cut off Emax crowns. We're having to cut off Bruxer crowns, and torque is the name of the game. So if you can get in and get through these crowns with a high torque handpiece, it's going to be much easier for you. And in addition to that, we all have to make adjustments from time to time, occlusally or on contacts on these restorations. And the way we polish them here in the lab is with an electric handpiece. We would never in the laboratory consider polishing a restoration before it went out the door or during fabrication with an air rotor. We do cutting with air rotors and diamond burrs, but all the polishing is done with electric hand pieces. Because of the torque, we can get a nice, wet, high gloss shine on the restorations. And so that's what I love to use when it comes to intraoral polishing as well. And because you love electric hand pieces, I'm going to send you a Bruxer adjustment and polishing kit from Access Dental that hopefully you can put into your cable electric handpiece and enjoy, because Megan, you've heard doctors complain about it. When you go to cut off one of those Bruxer crowns, it's not easy to get off because of how strong it is, and you actually need a very fine grit burr, which is kind of counterintuitive. And I wanted to show you something. I don't think you've seen this yet.
Okay.
This is from the Bruxer distributor in India.
Okay.
So our distributor who sells Bruxer to laboratories and dentists there, and this is their live hammer test.
Wow.
Now, the production cost for this would probably be pretty high in the U.S.,
yeah,
but they're doing this in India, and this is actually what they're going to send to doctors, is this box. Now, I was playing with it before you got here. It's literally the hammer test. So they send a block of wood, a hammer.
Is it a real hammer?
Yeah.
Whoa.
Not necessarily the highest quality in the world. In fact, when I hit it, be careful, the head might fly off. A screwdriver. So much like in the video, you can pry the crown out. And of course, it comes with a Bruxer crown itself. And go ahead, take a whack at it.
Oh my gosh. Okay, I'm scared.
Don't be.
Oops,
Well,
I
try to
missed
hit
it.
it
I
this
missed
time,
it. I missed it. I missed it. My golf game is not good. I missed it again.
I thought my left hand, that was your right hand.
Yeah.
Well, you missed it 4 times and hit it once. Let's see how our Bruxer retrieval system works. Thank you, Andrew. It survived, but
I was put on the spot. Oh.
I know. Oops. Well, that went a little bit into the wood.
You barely did it too. Okay, we get it.
I know, it's loud, huh?
Yep.
So it's kind of convincing for dentists when they get a chance to see it. I thought we could get...
I'm angry.
I thought we could get... When you got all that huckleberry, that's supposed to make you... You were so happy.
Oh, yeah, that's right. That's true.
I think this would be a great giveaway at, like, U.S. dental shows. If we sent out a coupon and doctors can come get this, it seems like it'd be fun just to show a patient or to let the patient, here's the crown that we're going to be giving you, especially if they had one break before, and let the patient take a few whacks.
Or they could put it in their waiting room, and the kids would love it.
Yeah, I can't see anything going wrong with that. I don't think there's any legal issues whatsoever. I think that's a wonderful idea. So anyway, interesting to see what they're doing.
Yes.
I don't know if any of the labs or we would ever consider sending this out to dentists. I don't even know if we could have it at a dental show. The CDA would probably start complaining if everybody took it out and started hammering at the booth.
Yeah, I could see
Not
where
fair
it'd
to
be
the
a little
other
bit of a
booths. So
nuisance.
interesting idea, and I thought it was funny. They sent us a sample so we could take a look at it, and I wanted to show the doctors that it actually does work when you do it live.
And that I have about zero hand-eye coordination.
Right. Good thing that you went into broadcast journalism and not dentistry. But do you have any news?
I do. The dental office of infamous lion hunter Dr. Walter Palmer reopened this week without him. In a statement released to the public, River Bluff Dental announced that they are open for business, but Dr. Palmer is not on site. They made it very clear that the employees will not speak to the media. Palmer made international news headlines in July after killing a lion outside of a protected wildlife area. The dental office closed shortly after due to protests. His website has shut down, and Google search lists the business as permanently closed.
Yeah, that's going to be hard to recover from.
Yep.
That's going to be a difficult one. I read an interesting piece, though, in the New York Times. It's from a college student at Wake Forest in North Carolina, and he grew up in Zimbabwe. And the article said, in Zimbabwe, we don't cry for lions. And it talks about how growing up in their village, they were terrified of lions. They were killers, and they did kill some kids and a lot of livestock. And there would be days where they couldn't go to school or couldn't go get water because of the lions. And they were terrorized by one particular one when he was younger. And he said when it was finally killed, they didn't ask, was it a local? Right. Was it a trophy hunter? Was it legal? Was it illegal? They celebrated.
They were just happy he was
and
gone.
so there's another viewpoint to all this. Yeah. But when I saw this, and when I saw the story, though, I felt like most people did. Why did it have to be a dentist? You know, and not another profession. Oh, no.
It's always the dentist.
Then there's all these articles coming out about how much money dentists make, and so they can afford to go down and kill things. And but it was kind of sickening too, posing with the animals, and I felt that same way. And then I I read that article and I was like, oh, there is a different viewpoint, as there always is in life. There's
Sure.
a different viewpoint, and I think maybe I was confusing, as he says in the article, maybe I was confusing Cecil with Simba, a movie I watched many times with my kids while they were growing up. But he's going to have a hard time getting any good Google or Yelp reviews. I think he's going to possibly have to go somewhere else in the state.
Right. I'm thinking either that or he's going to have to move to a different state and try to go maybe to a smaller town where, and try to reopen a business and reestablish a practice, because I can't see him doing well in the town that he lives now.
Right.
And we talked about this when Dr. Josh Austin was here on episode 145 and 146. Episode 145, we talked about this exact case, and he alluded to the fact that it's like, it's ruining not only this dentist's life, but then also his employees.
Right.
So yes, they're reopened, but those employees didn't make that choice. And so I would assume that not many people are going to go to his office. So now those people might be out of work. And it's just unfortunate. And to me, it just seems insane that they're writing on his garage with paint death threats. And, he hired a security to protect him and his family. And it's like, yes, he killed this animal, and think what you will about it. But then to threaten his life doesn't make any sense to me. But
placing human life below lion life,
right.
or equal to it.
Sure.
That he killed this, so it's
so
okay.
Now we're
okay to kill him. But I don't know. People sometimes, it seems, are looking for a reason to be outraged. I'm not saying this wasn't outrageous, but
right.
that it seems like it's going. I think losing his practice was pretty sufficient punishment. I don't think he needs to have his life or his family's life threatened.
Yeah.
Anything happier?
Yes, kind of. Kids losing teeth these days are also losing out on some extra dough. Forbes reports that American moms and dads are only paying about $3.19 per tooth this year, down again for the second year in a row. We're looking at a 24-cent decline from last year. Despite the decline, it's still higher than years past. The data comes from Visa's 6th annual Tooth Fairy survey, and the data varies by income, gender, and location. Turns out dads are more generous than moms, giving about $3.63 per tooth on average, while moms give only $2.87 on average. Guess which region of the country gives the most? Parents in the Northeast with an average of $3.56. The least? Southern parents offer a paltry $3.07 per tooth.
I'm just surprised Visa has done this study for 6 years in a row. Right. They apparently have an employer too, with nothing else to do.
Yeah, I guess so. But I was looking at, I'm like, okay, so even the least amount, $3.07.
Right.
I got $1.
Right. Yeah, that's what's weird. But I think their averages, I can't imagine anyone's leaving 19 cents with the $3. Right. My kids just asked me, or the Tooth Fairy, to Venmo them. They thought it just a totally wireless transaction, goes directly to their account.
Seriously.
And it's a lot easier to do it that way. I don't know what age kids stop believing in that, but the dollar just seemed like an easy way to do it. Or maybe a $2 bill if you happen to find one of those.
Right.
But yeah, the $3, I feel like, I don't know. And I don't know why dads give more than moms. Maybe as men, we just try to solve things with money.
Right, or maybe they're trying to compensate for guilt for being gone, at work during the day.
Someone's got to make the money.
That's right.
Honey.
To pay the Tooth Fairy
Tooth
bills.
Fairy, yeah, for this and the dental bills in the future.
Right, braces. They're not cheap, kids,
right.
Okay?
I think dads don't know what things cost.
No.
Like, I'm not good if I went to if you asked me what a gallon of milk costs, I'd take a wild guess, but I wouldn't know. But I've bought gallons of milk. I just don't pay a ton of attention to it, and I'm not going to more than one store to save money on
right, and that's frustrating because with Brandon, my husband, I'll send him to the grocery store and he'll come back with way more than was on the list, which is fine, whatever. But he doesn't look at prices ever. There's coupons? No coupons. We don't do coupons here. And it's I'm like, babe, did you even check to see? And he's like, no, he just grabs it, And I know growing up, my dad would do the same thing because I remember my mom saying, that he never looks at prices. I think.
Yeah, coupons are not manly.
No.
It's
not happening.
No, not going to happen. Even. Do you have a CVS card? Do I look like I have a CVS? This is what I want to. I don't know why, but I'll enter my phone. Now they have courtesy cards at least, where they
Right.
just go, if you don't have one, they'll just scan
Sure.
it. It's like, well, what's the whole point of the charade then? But
Yeah.
if they're just going to scan it like that. But yeah, men aren't going to use coupons, so men
Nope.
probably don't know what things cost, and men
No.
are used to just throwing money
Sure,
at
like,
it
let
or
me see
under
what I
the
got
pillow.
in my pocket.
Right.
Oh,
Here's
yeah. okay.
$3.19.
Here's some
Now
couple
let's go on
pennies.
YouTube and take your tooth out with an Estes rocket and make it worth it. Maybe that's why men
Maybe.
pay more, because they're the ones coming up with the incredibly cruel ways that we continue to feature on the show to take teeth out.
Got to pay for that therapy somehow.
That's right. Yeah, the tooth fairy money could have been used for the therapist. Well, that about wraps it up for this edition of Chairside Live. On behalf of myself, Meg, and the CSL crew, and everybody here at the lab, I want to thank you for your time and your continued commitment to quality dentistry.
We'll see you next time. And then in the news, it turns out that the Tooth Fairy has Susie Orman on speed dial. On this week's case of the week.
All yours, baby. You can do it. It's your cow. Yeah, coupons are not manly.